Cardio-oncology is specifically caring for patients that have cancer or a history of cancer or a new diagnosis and are going to be starting chemotherapy or radiation. And it's taking care of these patients specifically as a cardiologist because patients can develop cardiotoxicity from either their cancer itself or their treatment of cancer. And we even see patients who had a history of cancer years ago because some of these chemotherapies can actually have long-lasting effects. So you may develop heart failure, for example, if you had exposure to certain chemotherapies, even 5-10 years ago. The care of the cardio-oncology patient is a little bit different than the care of just a general cardiology patient because of those exposures to chemotherapy and radiation. So we have, for example, different guidelines to how we do risk factor management, so blood pressure management. What medications I would choose for a cardio-onc patient would be slightly different as first-line medication I would choose for a general cardiology patients. We also create sort of what's called a surveillance strategy for all our cancer patients that are undergoing treatment. So how often do we do follow-up ultrasounds of their heart to keep an eye on their heart function, not only during the course of their cancer treatment, but even once they're in remission, long-term follow-up as well. So the prevalence is actually fairly striking because a lot of people have cancer. There are a lot of survivors as well. If you look at the National Cancer Institute data, in 2016 alone, there were 15 million cancer survivors. And so it's a fairly large population. And who develops the cardiotoxicity, it depends on two things. It depends on what chemotherapeutic agent you're exposed to and what cardiovascular risk factors you have. And cardiovascular risk factors are very common. Things like high blood pressure, diabetes, smoking, family history, obesity, sedentary lifestyle. Any of those risk factors combined with exposure to certain chemotherapeutics, especially things like anthracyclines, there's much higher risk of developing cardiotoxicity. I think the care of the cardio-oncology patient is particularly special. Cancer it's really a lifelong disease. And so as a cardio-oncologist, I really get to take care of these patients lifelong and really build that relationship, getting to know them. Certain other cardiac conditions, for example, you have an arrhythmia, you get that treated, and you don't really need to see the cardiologist anymore. But with the cardio-oncology patients, I think there's a much sort of deeper involvement of the care because cancer is a lifelong condition. Even in remission, you can still have effects on your heart later on in life. So I think it's a really special relationship with those patients.